Good morning.
Good morning.
And welcome and thank you all for coming. My name is Jim Connolly. I'm the President and CEO of Ellis Medicine. And I want to extend our special thanks to Mayor McCarthy for the use of this beautiful space this morning. Ellis is proud to have been a part of a coalition of community partners. Together, we call ourselves the Schenectady Coalition for a Healthy Community. Today, together, we are excited to announce a first-of-its-kind community-based initiative for Schenectady County. Together, we're here today because we're committed to a shared goal to improve health outcomes and quality of life and to reduce disparities by better meeting the needs of our community. As you probably know, Ellis has been providing care to our community since 1885, and it has been our privilege to provide care to this community and all the families that reside in it. But it has also become very clear to us that health is much more than health care. Health is also about having a safe place to live with access to needed clinical and social services and tools that support healthy choices and a healthy lifestyle. There are many issues that contribute to health and well-being, or in some cases, preventing people from achieving it. And solutions to those community issues often require a community response, a collaborative community response. And that's why we're all here today. The Schenectady Coalition for a Healthy Community is comprised of more than 40 community partners experienced in working with the underserved. You'll be hearing from some of them in just a few minutes. We are providers of essential services and resources in healthcare, social services, and education, and we represent key community and service organizations. We are all listed here on the poster up front, wherever the poster is. We've got an established record of accomplishing important things like the medical home. It was this group that helped bring about the medical home here in Schenectady and helped with its evolution into our Care Central initiative. So what's the new project we're all so excited about? It's an inspiring and innovative idea that has worked in other areas, like in Chicago, where childhood asthma was identified as a major health issue in several neighborhoods, and it's being successfully addressed by a community. In less than 48 hours, we're going to be kicking off this initiative in Schenectady. I'm happy to introduce to you Debbie Schimpf, Executive Director of SCAP. She'll explain more about the new initiative. Debbie?
Thanks, Jim. Thanks for everybody for coming today to hear about this really exciting announcement. It's my honor to tell you about our new and exciting project called UMatter Schenectady. But first, I want to take the opportunity to tell you a little bit about SCAP and the importance of the Schenectady Coalition for a Healthy Community. For nearly 50 years, SCAP has provided services to low-income families in the county, helping hundreds of impoverished people every week who walk through our doors. Imagine, if you will, you are working full-time and earning minimum wage. You have 3 children, 2 in grade school, 1 in preschool. With this salary, you must provide a home, food, clothing, pay utilities, provide transportation, secure child care, and provide any number of unexpected expenses that routinely arise, such as healthcare costs. As difficult as this scenario sounds, this is what it's like for most low-income families. On behalf of them, SCAP is proud to work with the Coalition for a Healthy Community because the health and well-being of every resident in Schenectady County is the Coalition's priority. Together, in partnership, is how we'll meet the goals that Jim mentioned, which are to gain a deeper understanding of the unmet health needs and do a better job of meeting those needs. Okay, so here's the plan. The Coalition will conduct a door-to-door survey that will be rolled out in the city of Schenectady, neighborhood by neighborhood, family by family. The survey will help us learn about the community's healthcare needs, and it includes questions about social and environmental factors that influence health. But most importantly, the survey is localized, developed to identify health concerns and disparities existing in neighborhoods. We have 16 specially trained surveyors, or as we're calling them, community health workers who live and or work in Schenectady. At least 3 of them are here today. They're wearing their UMatter Schenectady t-shirts. They're going to begin their work this weekend and continue for the next 12 weekends. Many of the community health workers conducting the surveys have received help from SCAP and our partners and have overcome significant challenges of their own. One example is Gisela, who graduated from our Career Readiness Program and then went on to complete her Community Nurse Assistant certification at SCCC. She's now a working CNA, and she's also participating as a community health care worker. We're really proud of all of them, and we thank you very much for your time and your efforts. Once the survey is completed, we're going to prioritize the identified needs and build a community-wide action plan based on these needs. The pilot project will focus first in the city neighborhoods, and we hope to expand to suburbs and rural areas of the county next year. At SCAP, we've adopted the mantra, develop no services for us without us. The UMatter Schenectady campaign is committed to this. So in closing, I want to send a message today to the residents of our Schenectady neighborhoods. This is an opportunity to share your voice and to be involved. If a surveyor knocks on your door, please complete the survey. We need you. And now I'd like to introduce another member of our Coalition for a Healthy Community, Mike Sicoscio, Executive Director of City Mission. Mike?
Thanks, Debbie. Well, City Mission is very excited to be a part of the UMatter Schenectady campaign. I think this campaign is important for many reasons, and these reasons are indicative of the positive things that are happening in our community, the positive direction we're moving in. First of all, the process itself. This is not a top-down process where some experts are gathering in a room, making assumptions, saying we know what needs to be done, now we got to get people to do it. This is a recognition that the insights, the answers, the facts are in the folks themselves. And so the way to hear from the folks is to go to their homes, to go door to door, listening to people, not expecting certain answers, but truly listening to what people have to say. It is a recognition that we need answers, and a lot of the answers are in the community. They're in the homes of the folks that we're going to be visiting with. It's also going to create opportunities for folks to share their opinions, to attend community sessions, to have comment and have voice on priorities. Because in the end, if you're going to do dramatic changes to how we build community health, the folks themselves have to own it. It's the only way that health can be sustainable. That's what our goal is here. That's what our passion is. We're creating work opportunities, as Deb mentioned, that the best people to run these surveys are folks from the community, folks with experiences who have credibility, who know how to listen. We're creating opportunities for them, economic opportunities, and realizing, saying, look, you're the leaders. We're on your team. We're here to provide resources, but you are the leaders who can make the difference here. The other final thing I'd like to say about the UMatter Schenectady campaign is that it's collaborative. And that is a powerful thing in Schenectady these days. We are a collaborative community. We come together, we do things jointly, and what this means is that you have this broad range of resources. So as things that are uncovered, they may not be related to healthcare. It might be something social, something else. But there's going to be the capacity to draw from numerous resources to meet that need as well. We're going to be solving problems that haven't even emerged yet, because we're going to be learning about them early on. So that's a breakthrough. Say this in closing. There is a great deal of trust amongst the collaborative partners in Schenectady today. Trust, I've learned, is the foundation of effective collaborations. Today I can say that the thinking in this community has shifted from what is best for my agency to what is best for our community. That is an environment for real and lasting change. That's an environment where UMatter Schenectady can succeed. So thank you, and we look forward to this kickoff.
Thanks, Mike. Just to pick up on something that Mike said, he said we're going to be discovering problems that haven't, or coming across the problems that haven't been discovered yet. Actually, that's one of the lessons we took away from the Chicago experience, where they looked at data, they saw statistics, they saw mortality, morbidity rates, but it was when they went door to door in the neighborhoods that they found unique health problems in neighborhoods that were, a different health problem than existed 3 neighborhoods away. And they started to peel away the underlying causes and as a community come together and resolve those. So it very much will come out of this process, hopefully, some problems that otherwise we would have missed completely. That's a really, really important point. We're very fortunate to have officials at the city and county level who are champions for the health and well-being of our residents. The Coalition is enormously grateful for the support of the city and the participation of the Municipal Housing Authority in this grassroots community effort, and I'm very honored to invite Mayor Gary McCarthy to the podium to share a few thoughts about the pilot project. Mayor.
Thank you, Jim. I want to thank everyone for joining us here today. The City of Schenectady is pleased to support the UMatter campaign. We're excited that this pilot project will concentrate first on neighborhoods here in the city. The city has long focused on both the strengths and needs of our neighborhood, and this is going to give us the empirical data to better allocate those resources that the city has and other community partners have. And again, it is an impressive group that has been brought together to undertake this project. There's over 40 participants that are represented, I'm not sure if everybody's here today, but are represented in the coalition. So it's exciting. It's going to produce long-term results. And we encourage people to take the time when a surveyor comes to the door to be patient with them, to fill out the survey, to be frank with them, to go through it, and it's going to give us, again, that data that's going to allow us to make the changes and improve the quality of life, both in terms of health and some of the other environmental criteria that does make the quality of life so different, and it'll help make this community the place where people want to live, want to raise a family, and want to be proud of. So I thank everyone for being here today. We look forward to working with you, and only good things are going to happen.
Thank you, Mayor.
Thank you.
Thank you, Mayor. The Schenectady County Public Health Services is an invaluable community partner and longtime leader of initiatives to support the health and wellness of county residents. And if I can add Ellis's own comments to this, they have been an enormously important partner to us and enormously helpful to us, whether it was with our medical homes, whether it's the operation of some of the clinics in the county, or most recently, actually not recently, but over the last several years, in operating the visiting nurse service. They're just a wonderful, wonderful service and wonderful, wonderful partners in this community initiative. So it's my pleasure to introduce Karen Johnson, who is the Vice Chair of the Schenectady County Legislature and the Vice Chair of its Health Committee, to the podium. Karen, thank you.
Well, Jim, first of all, I'd like to thank you for those kind words, because I am not directly involved in the health department, but I am an observer of it, and I observe exactly the same thing, that under the leadership of Joanne Cocazzoli and Dr. Pratt, our medical director, and along with interns from the School of Public Health and all the nurses that have been with us for so long, we have become national leaders in public health and are working together in non-traditional ways to improve the public health. And so this is a very great project for us, and I'd just like to thank the Schenectady Foundation for its support of the project. Schenectady Foundation is often way ahead of the rest of the community in thinking about long-term ways that we can solve problems. So we're very excited to be collaborating with this. First of all, as you know, you've been told, this is a very broad partnership, and it recognizes the complexity of the health care, housing, access to health care, access to food. And finally, we're going to let the affected people have a say. And so I just want to draw a little scenario. This Saturday, we're going out with all these great people who've got the T-shirts on, and I hope they have warmer clothes. We're going to have extra large T-shirts to go over the coats. They're going to come to your door, and they're going to have this survey, and it's going to be a cold and windy day, and you have to decide whether you're going to let this person in and spend your time answering questions that might take up to 20 minutes. And they're not invasive questions. They're not real personal questions. They're questions about how your neighborhood affects you and your housing. And this is your chance to set policy in this community, to say things to people that are going to change the way your government does business. It's going to change the way the 40 agencies that are partners support you. And it's going to make this community a better place. And you're taking that time this weekend and the following 12 weekends can make a tremendous difference. And so we urge you, let the folks in, take the time. It's almost a once-in-a-lifetime chance to make your community a better place. So thank you so much. Thanks all the coalition members. This is a great start, and I think all of us will be waiting with excitement to see the outcome. Thank you.
Thank you, Karen. You've heard a number of people talk about the importance of this initiative as being a community collaborative coalition. And the next person I get to invite to the podium is the very embodiment of that. We wouldn't be standing here today if it weren't for the support of the Schenectady Foundation. The Schenectady Foundation has made this pilot project possible by providing the coalition with a generous $100,000 grant, and we couldn't be more grateful. TSF is a steadfast supporter of initiatives that strengthen families and improve our communities in the Schenectady County. When we were in the meeting rooms and talking about launching this initiative, this gentleman was across the room, and I went over, and he knew what I was coming over to talk about, and he never once faltered, and he has never faltered in supporting the collaborative community efforts to make our community a healthy place for raising families. It's my pleasure to introduce the Schenectady Foundation Executive Director, Robert Garreau. Robert.
Thank you very much, Jim, and all my colleagues from the community. Your work on this, all your support and collaborative effort is making truly a difference in our community. And thank you for your kind words, Karen, as well, about the foundation. You know, for a long time, we've all worked, all of us together and in our own ways in our missions to try to address community issues. But for the most part, particularly when it came to health issues, we've relied on kind of high-level, more general data, county information, county level, which doesn't really tell us always what's happening in the neighborhoods, doesn't give us an ability to really carve out a clear strategy as to how we're going to address those. So when, I think it was about 8 months ago, Jim called me, and I always answer when Jim calls, so it's, even though I know what's part of the conversation is. And Jim talked to me about what had happened in Chicago and in Western New York and a few communities that had gone down this path of trying to get a community level survey going, and instantly it struck me that this is going to be such a critical piece of our community collaborations to be informed by data, to be able to have a coherent strategy to actually address the issues on the ground level, neighborhood by neighborhood. And we've lacked it. This is going to be such a great asset, and as Mike and Deb and others have said, to really truly engage the community in this process and not make it a top-down model. So when Jim outlined this, we were, on board in terms of the concept, where we wanted to go, very supportive of seeing this rolled out. So I thank Jim for really initiating this and bringing this back. He shows you the value of actually going outside, going to conferences and hearing what other people have to say. You bring it back to the community, best practices, so that's another great thing. So this is really an unprecedented opportunity. We are very grateful for the chance to invest in this. The Schenectady Foundation has made this initial commitment of $100,000 to get this off the ground and going, and we very, very much look forward to seeing the results of this first stage so that we can then consider what do we do about it. And hopefully we'll make this a very collaborative approach in how we fund the solutions as well. So thank you all very much.
Thanks, Bob. As we've mentioned, this project is all about focusing on and engaging neighborhoods in our community. And because the grassroots run deep for this initiative, The coalition is supported by a community committee of folks who live and work in Schenectady and contribute important perspective. As a matter of fact, community members came up with the slogan, UMatter Schenectady. One of those members is Ed Kozier, Vice President of the Schenectady United Neighborhoods, and it's a pleasure to welcome Ed to the podium.
Thank you, Jim. The previous speakers have already addressed many of my talking points. So I'd just like to reiterate the importance of this project as a community approach. Whether you're a homeowner, a renter, senior citizen, a parent with children, or just a proud resident of the city of Schenectady, we need your support and participation in the UMatter Schenectady survey. The Schenectady United Neighborhoods are proud to be a part of this team. In fact, we are leading the way in working with the project leaders in offering them suggestions and locations where to offer their surveys during the week. Many of our neighbor associations will be hosting the UMatter Schenectady surveyors at our upcoming monthly meetings. I'd just like to take a quick moment here to acknowledge a few of our Sun members who are with us here today. Marva Isaacs from Hamilton Hill Association, Linda Kelleher from Central State, Sharon from Mount Pleasant, and Camille from Goose Hill, and of course myself from the Woodlawn Neighbor Association. One final thought. I don't recall anybody mentioning that everyone who completes this survey will be given a gift card from Price Chopper as a thank you for their time. We'd want to thank Price Chopper for their commitment to the UMatter Schenectady program. And we look forward to working with the coalition as it proceeds throughout. Thank you. Thanks, Jim.
And I would certainly be remiss in not repeating the appreciation to Price Chopper and to the family that supports this community so wonderfully, that it is the whole entire Price Chopper family. So we're very, very grateful for their support. Thank you, Ed, and thanks to your entire group for your enthusiasm and support for coming up with such a great name for this initiative. I also want to point out Aaron Buckemeyer. You can just wave to everybody. Erin is the Community Health Outreach Coordinator. She is in charge of this project, and she is doing a phenomenal job, wonderful job, so thank you for that. I want to thank you all again for coming and sharing in our excitement. It's our hope that ultimately the UMatter Schenectady, that through UMatter Schenectady, our families will be healthier, our communities will be stronger, and the quality of life will only get better. And we'll accomplish it together, beginning with this important first step. So again, remember, kickoff is this Saturday in the North End neighborhoods. Our surveyors will fan out from 10 a.m. to 4 p.m. So please, when a surveyor comes to your door, take the time out to let them in. Provide information, share your story. It's the best way that we can help you is if you tell us the specific help you need. So remember what we have talked about and that we really mean it when we say, and you all have to get together here, on count of three. 1, 2, 3. UMatter Schenectady. Thank you all very much for coming. That was good. They're good. So Mike meant about being a really good coalition. We're all reporters. We're very happy to answer your questions in the room down the hallway. Please join us to talk with the coalition partners, with our surveyors, and also to demonstrate the survey. We'll have that available for you. Thank you again, everybody, for coming.
Thank you.
Thanks, guys.
Thanks, Jim. That was good.
Yes, sir. We will. We will. We will.
Okay, well, that was wonderful.
Yeah. We'll be warm out there. Good to see you, too. We'll make it happen. Yes. Yes, we'll take your time. All right. Yes, ma'am.
I like these.